Well, I came in 2004 as the Chancellor for Health Affairs and CEO of Health System. And of course, at the time, there was town gown issues in Durham and lots of challenges and mistrust. Duke Health System was formed somewhat recently, and we took over Durham Regional Hospital, which is now called Duke Regional Hospital. And of course, at the time, there was such mistrust that both physicians and public and even the county commissioners thought Duke would take it over and they're the 800-pound gorilla and they won't pay any attention to the community, right? And that's when MaryAnn came in. She helped me navigate the politics, coached me to work with the community, and some of those meetings were tough. People were not shy to tell us what they think about Duke at the time, but MaryAnn taught me patience and the art of listening and developing the kind of relationship that's needed. And then through action, she always reminded me about action, do the right thing. We eventually developed the trust in the community. So I would say that I can't imagine how I would have done my job without MaryAnn. Having someone like her sitting next to you, and when you have tough conversations with the community, they can look at MaryAnn and say, we trust her. We may not trust you, we trust her. And you're going to keep this guy honest, right? And so it's not just health care. It's a lot more than health care. It's education, it's jobs, it's housing, you name it. So we went well beyond health care to really about everything about Durham we're involved with. And that was really important. So of course we did what's expected of us. We created neighborhood clinics. That was new at the time. I still remember opening Houghton and Wartown and clinics like that. But now we have lots of clinics everywhere. So I think this really memorable moment for me was in the basement of a church, the Baptist church. MaryAnn and I, along with the community commissioners and many others, talked about what we must do. And we all agree that Duke must do more than what we're doing at that time. So we said we committed to it. They know our word was good. We came back and talked to the PDC and the specialists. They all came together and say, we'll provide free specialty care. That was Project Access, 2008. And as you know, Project Access is enormously successful in providing a lot of care to this. That was a really important moment, at least for me. Very early, it was MaryAnn's idea that we can actually bring Duke to the education system. Because we know in the city of medicine, why not create something that emphasizes the health profession? The idea at the time was to create a school within the school. That is, within the Southern High and elsewhere, just having a special track of people interested in health and giving them extra kind of opportunity to learn. We went much further than that, right? We created City of Medicine Academy. It was MaryAnn's idea and Carl Harris. It's the most competitive lottery school, and it's graduated 100% for the last, 6, 7 years. That was MaryAnn.
The thing is that MaryAnn was trusted in the community because she lived in that community. She grew up in an African-American community. I mean, Victor and I can have empathy, can have, can think about doing the right thing by somebody. So she knew what people were up against, and she really was the the barometer and the consciousness of what really is happening to communities.
And if you look at everything we face with today in our nation and our state and our community, I think it's the socioeconomic issues that's so important. The issue of equity, right? The issue of social justice and racial justice. MaryAnn understood this. And so for her to follow through It's because of her commitment to the community, her persistence, right? And because she convinced a lot of people. I mean, she convinced us, although we didn't need a lot of convincing, but she brought us along with her vision that made us better people. I always say, people say I'm her boss. Far from it. She was my coach, my mentor. She made me a better person and a better leader. And you know, in many ways, her spirit is still with us, because Ruthie and I talk a lot about what else can we do for Durham. In fact, we're reaching out to a number of people, now that MaryAnn's not there, to say, can you give us some guidance, particularly during the time of COVID, when there's so much need for food, for housing, you name it. We're working on those things, and we're doing this in memory of MaryAnn.
Mm-hmm. And I think to add to what Victor just said, there have been, you know, several situations where we've been talking about something, we look at each other and say, MaryAnn would know. She would absolutely know. And then we look at each other and said, okay, what's plan B? I think she changed the narrative on many, many levels. But you can have a legacy, but unless people act upon it and understand the ramifications of not acting upon it, then it's up to us to basically carry a legacy forward and making sure that it does not diminish in any way.
I also think her legacy is she's made Duke a better place. She made Durham a better place. She made the state a better place. There's no question that we won't be where we are if we did not have MaryAnn. And as Ruthie said, we need to carry out her legacy to continue this journey.